morning, everybody. Good morning, everybody, and welcome to Amen. Amen Power Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. Amen Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. Amen Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, we do encourage you to call in to join in today. Well, let me start off by saying, hey, did you take your calcium supplements and throw them away today? Well, if it sounds strange to you, and that means you haven't really been listening, but if you're just tuning in today, you may want to pay close attention to our guest who has his new book entitled Death by Calcium, and you just might want to throw those calcium supplements away. For sure, he's going to tell you to throw them away. If you want to learn why, pay attention when we have our guest. Returning back live with us today is Dr. Thomas Levy. He was in town this month. He is back. He just can't bring in such a topic and then leave town without saying goodbye. He's coming back to say hello and goodbye and explain why it is that you got to throw those calcium supplements away. Dr. Thomas Levy, our guest today. If in the course of discussions with Dr. Levy you want to call in to ask a question or make a comment, the number, of course, to do that is 412-825-6262. That's 412-825-6262. I'll give that number additionally throughout the hour. We turned the page today, folks. It's been a very fertile and active April, especially from this vantage point, this chair. But we turn into even a more active month in the month of May. Now, let me just say, after returning from Reno, Nevada, in the backyard of Dr. Frank Schallenberger, Prolozone is alive and well here in Western Pennsylvania. And I want to reiterate, that's Prolozone with a Z and not prolotherapy with a T. T's are up, Z's are in. Be talking a lot about in upcoming days this issue of Prolozone therapy and how beneficial it is for pain problems that may have developed literally anywhere throughout the body. What a wonderful therapy it is. And I'll be sharing that with you many times as time moves on here in May and further on into the future. May holds for itself its own set of charms. Tomorrow, free seminar here at the office. Those of you who have an interest in our eye program, of course, we're known as the Pittsburgh Eye Protocol. We've been so since July 2013. The Pittsburgh Protocol utilizes the protocol put together by Dr. Edward Condra to reverse very serious eye diseases. In particular, the retinal ones, the ones that really don't have any place to take it with respect to conventional treatment. There is no treatment, in other words, for these serious conditions known as macular degeneration, whether it's wet or dry, glaucoma, diabetic retinopathy, cataracts, special category altogether, but nonetheless, these four are the biggies. If you suffer from any of them, or you know someone that does, we do special protocols here, 3-day treatment protocols, where we're going to talk about them tomorrow night. Free seminar here in my office, 6 o'clock. If you'd like to come, if you know somebody you think should be here, give them a call and have them give us a call too, so that we can reserve a seat for them. The number here is 724-942-3002. The 10 Eye Essentials book will be given to you free of charge as a gift. It's $25 value, and it will set the stage for things that you can do for yourself at home while you contemplate whether you can participate in our 3-day treatment program. By the way, the 3-day program this month is going to be held on the 20th, the 21st, and the 22nd. Plenty of time to get your records in and all that is necessary if, in fact, you think you'd like to be a part of it. You can also call in and talk to Sarah, who's pretty much running this show, and she will be able to fill you in on whatever information you may need. Once again, that number is 724-942-3002. Now, on Friday, special day for Dr. Chaudhry. out there at his brain health conference. The venue is Chestnut Ridge Golf Club, and it is in Blairsville. It's going to be an all-day affair. I will be there. I couldn't miss this. The keynote speaker, folks, is none less than Dr. Louis Melmadrona. Used to be the head of the alternative medicine department at Shadyside Hospital. He's gone off, I believe, to bigger and better things, but he's coming back and going to spend a weekend with us. It all kicks off a full day's worth of activities and discussions and lectures with, I think, 8 o'clock, I believe, is when it begins. If you think you're interested in attending, give him a call out at Seclair. Here's the number, 724-468-3999. That's 724-468-3999. And reserve a spot for yourself. Next week, Susie Weiss will spend some time with us on Monday, because you know why. Because Susie's going to be here on Thursday. It's her first Thursday, well, actually second Thursday of the month, where she'll spend some time with any of you who have an interest with the essential oils. She represents a company called Young Living, who've done this job very, very well, and she's so knowledgeable on the matter. We'll find out what she plans for you all on Monday when she spends some time with us. On Wednesday, Dr. Vavoom herself, Susan Smith-Jones, will be our guest. She just, she's driving the thing whenever she's here. She just takes over, and she'll be talking about the topic of the month that she selects. What else have we got here? Hey, like the week following, he's coming to town. Dr. Boyd Haley. Now, we've got some top-notch people visiting Pittsburgh. Tom Levy, of course, takes second billing to no one. Boyd Haley, when it comes to the arena of heavy metals, and in particular mercury toxicity, there's not a man alive who knows more on the subject than he does. He's coming to town, folks. He's going to be our guest on the 12th, which is the Monday of the same week that he'll be here speaking at the Freedom of Choice and Cancer Therapy Group. He's going to be there at May 15th at 7 p.m. at Riverside Landings out there in Oakmont. You don't want to miss him. 7 o'clock is the start. And if you have any questions about heavy metals or what to do about them, this is the guy that you want to ask. We'll be asking some of those questions when he's our guest here on the 12th. We'll just set the groundwork for him to allow you to really cross that off on your calendar. The evening of the 15th, you don't want to miss him. He'll be at the Freedom of Choice and Cancer Therapy Group out there in Oakmont at Riverside Landings. So that's the way things are pretty much shaping up here, as you can see. Just a couple more words about the wonderful conference I returned from. Dr. Frank Schallenberger. His base of operations is in Carson City, Nevada, and he's within 30 or 40 minutes of Carson City is this town called Reno. A bunch of doctors from all over the world. They came from all over the place. The place was packed. Ozone is hot now, a hot topic. Ozone has come to western Pennsylvania, and we've been talking about ozone with respect to its ability to help conquer serious organic disease. Now, with the realm of prolozone, all the pain problems that you may have, you want to check us out. Head to the, I hope you enjoyed the repeat show we did with Dr. Frank Schallenberger on prolozone. Go to the website, go to my website at djcmd.com and click on the icon marked archives, and then just dial in ozone. There'll be 3 shows to come up. One of them is going to be on the prolozone itself. We'll be bringing Frank back on the show, and maybe something really special is in the offing when it comes to Dr. Schallenberger. Dare not say anything about it now. Nonetheless, you'll be hearing a lot from Frank, and maybe in your own backyard. So that about rounds it out for this morning. I'm really anxious to get to our guest today. This gentleman is brilliant, an author of 8 books. His last one is, as I say in the industry, a killer, but actually it's describing a killer. It's describing death by calcium. His name is Dr. Thomas Levy. We'll take a short break, and we'll be back with Dr. Levy.
You become confused.
Okay, he's waiting. Hold on.
Okay.
Every time you turn on the television or radio.
Good morning, Tom.
Hi, Dennis. How you doing?
Hey, I'm doing great. Thanks for setting your alarm and being here this morning. You won't have any trouble following my cues on this one. I'll just lay the groundwork saying you blew into town, you blew up this whole issue of calcium, you left town, and you've come back to answer pretty serious questions when it comes to people on the calcium matter. And so I was looking at the book, and I want to get into some of your myths. I don't want to give them all up. I do want to talk about the treatments as you see them for things like osteoporosis that you taught us the night you were here. And then hopefully we'll get some questions from our listeners. Fair enough?
Okie doke. Sounds good, sir.
All right. Hang loose. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KSP 620, each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you today on a Wednesday morning version of the show, last day in April. We're turning the page today, but we opened this month with a page that has really rocked our world when it comes to the supplementation issue. A brilliant gentleman, has gone into the literature and found out why you need to throw your calcium supplements away. And if that sounds shocking to you, then you're going to enjoy, or you don't want to miss this hour when Dr. Thomas Levy, who was the guest at the Freedom and Choice in Cancer Therapy group this month, now returns to, he shook the ground we walked on. Things have sort of calmed down now. We got to have a re-explanation of this. Dr. Levy is a internal medicine board certified internal medicine cardiologist who's been now the author of 8 books. His most recent one, Death by Calcium, and he means it. Let's get him on board today and ask him some of those probing questions about how in the heck this stuff may kill you. Well, he says so. Dr. Levy, thanks for allowing us to invade your morning, and thanks for coming aboard.
Good morning, Dr. Courtney. Always happy to be with you.
Well, Dr. Levy, you blew in town pretty much like a hurricane. You really roughed us up with a topic that rocked the world of the majority of people who were in the room. But this book is going to rock the world of many people around the world because it's so anti what they believe is supposed to be good for them. You say there is death by calcium awaiting you. Let's get to this title, which is a pretty grabby title, no doubt about it. How is it that your research came about, and how is it that you learned that you can die from taking calcium?
Well, certainly everybody knows that calcium is necessary for health, okay? It's a vital element in the body, and it performs many important functions. However, having said that, what's also less known about calcium is the amounts that you need are within very rigid ranges of normal. And when you start getting out of those ranges of normal, what's otherwise a vital substance becomes a highly toxic substance. Now, what has happened and has evolved over the years is the fear of osteoporosis, fracture, and worsening osteoporosis, and knowing that osteoporotic bone is low in calcium has reflexly, if you will, created an entire medical industry of calcium supplementation. It's very simplistic thinking, and as we'll talk later on, it's absolutely incorrect thinking, but the simplistic thinking is if your bones are low in calcium, then you need to take in more calcium. But the critical point that gets completely overlooked is that the many years in which you're losing calcium from your bones, that calcium is going elsewhere in the body. You have a large reservoir of calcium in your bones. It's over 99% of the calcium that you have in your body. And as the osteoporotic process proceeds over the years, it releases calcium into the bloodstream. Some of it gets excreted normally in the urine, and the rest starts accumulating in the tissues and even getting inside the cells. And this is where the toxicity starts. So what happens with calcium supplementation is you make a bad situation worse. The evidence clearly shows that calcium supplementation actually does not decrease the chance of an osteoporotic person having a fracture, which is the only point of trying to treat osteoporosis, is to lessen the chance of a fracture. And at the same time, it's not decreasing the chance of fracture. It's substantially increasing your chance of death from other causes. Heart disease and cancer quite prominently. The calcium goes where it's not needed. It deposits. It makes little rock-like deposits outside of the tissues. It accumulates inside the cells, and when this happens, oxidative stress increases, and all the chronic degenerative diseases that accelerate, including cancer, but absolutely all chronic degenerative diseases. So we need to have a complete, if you will, remolding of our attitude scientifically and therapeutically toward calcium and diseases that we considered to be calcium depletion diseases when they're in fact calcium excess diseases.
Wow. This research that you started, as you went into it, did you go in there already knowing that this was a killer? Did you go in there with an open mind and just said, this is where the literature now takes me? Tell me a bit about how that process worked, because, I mean, the ultimate conclusions really, from what I hear from you, are really unavoidable. So my question is, how is it that Thomas Levy stumbles across this and nobody else ever did?
Well, it's not exactly nobody else, but I will say, I guess, nobody else has really, to my knowledge, taken a vigorous review of the literature in the process. Dr. Hal Huggins made me aware 20 years ago of excess calcium. I had high calcium in my hair analysis. I said, what's going on here? He said, well, that's going to cause problems everywhere. You need to do this, this, and this, and you'll normalize it in a few years. And that was right. It took a few years, but I normalized it. Then I started accumulating information and said, well, you know, this calcium's bad stuff. I gotta write on this someday. And then, gosh, 20 years went by. Actually, more like 15 years went by, and I had procrastinated. I had written other books, had other things on my mind, and then I was getting ready in about 2010 to finally start working on it, and they came out with a study from New Zealand that showed calcium supplements increase your chance of heart attack. And then I said, oh, well, I waited too long. I've been scooped. I mean, the word is out. Now people are going to stop using calcium. Doctors are going to stop using it. And I didn't think anything further of it. I said, well, somebody did it before I did. Well, as we all know, Dr. Courtney, that was just a study, and studies quickly live and quickly die in the literature, and nothing else is further made of them. So, as it turns out, I saw calcium supplementation continue to increase, and I said, wow, nobody's paying attention. And so I started in 2013, and over the course of about 6 months, went through the literature, and I was absolutely stunned. Stunned is the only word. I mean, every day I'd have 4 or 5 wow moments as I would go through the literature and say, this is absolutely mind-numbing to see that this information is there, and doctors are continuing to promote calcium supplements. Patients are continuing to take them, And even worse, as it turns out, dairy products with high levels of calcium are continuing to be promoted as health foods, which is exactly quite the opposite. But as it turns out, I will say this, things pretty much turn out for the best, and had I written the book 10 years ago, it would have been okay, but it wouldn't have been nearly as impactful as the incredible amount of information in the literature that's accumulated in 2011, 12, 13, and 14. I mean, it is really, if you will, for anybody who's willing to expose themselves to the information, has put the nail in the coffin of calcium supplementation.
So you may already have answered my next question, which was, here we are out there trying to do the good work. I'm probably one of the biggest abusers when it would be to recommend that people take calcium. I have to say, look, I've been in error all this time. How did it get this way? How did it come to this point that we missed this? Was it so intuitively? It seemed like the right thing, maybe, that you don't have any calcium in those bones. We want to put it in there, and the fact that it doesn't go there, we weren't really paying attention.
Yeah, I would say misguided intuition was a large part of it. Certainly, osteoporotic bone is low in calcium, and many things in medicine, if it's low, you take more of it. But as you know, that's not always the case. So I would say it wasn't completely unreasonable. I mean, it's not as illogical as some of the things we do in medicine. Very little has been described about the toxicity of calcium. It's simply described as something that the body needs. And many docs have not taken the time to go into the biochemistry of this and realize that the calcium outside of the bones is really a very delicately regulated nutrient. And it does not take much to get it out of whack. This, of course, combined with, and this is where all the synergism, if you will, comes from, the dairy industry. I mean, we have milk is a natural. You never outgrow your need for milk.
Yeah.
Got milk. And milk, one glass of milk is a massive overdose of calcium for the day. And if you drink milk on a regular basis, you are pumping enormous amounts of calcium into your body that, statistically speaking, you will pay the price for later on in life if you don't have the ability and the opportunity before you start getting old and sick to start getting that calcium back out again. But anyway, I will say this, unlike some things in medicine that we do that are, shall I say, delicately illogical and inappropriate, there is a certain logic to the calcium. It's incorrect, but there's a certain logic to it. So that's why I've found so far that really every doctor, without exception, and every patient without exception, and I've already gone through and encountered quite a lot of people on this subject, completely embrace the information in this book, and the only ones that are reticent to embrace it, not surprisingly, are those that have some sort of investment in calcium supplementation or dairy. And I'm not saying they just reject it, they just don't want to open their minds and their hearts and then suddenly start taking money out of their pocketbook.
Yeah, sure. At financial motivation, sometimes it's really tough to have the brain switched on and remain on. But we'll let them deal with their demons in another way. You point out in your book, and I've got to recommend this book and to everybody listening, this topic. If you want to find out the research and what it finally led to, Death by Calcium, your newest book, absolutely does a fantastic job, Dr. Levy. You point out various myths, and although I don't need for you to go through all of them, these myths, however, turn out to be the guide by which this thing got completely out of control. Could you spend some time talking about the myths concerning calcium?
Well, the biggest myth probably we've already talked about a little bit, but it's the fact that because there is a deficiency or a lack of calcium in osteoporotic bone, or a calcium deficiency, that immediately gets generalized to saying, well, people are calcium deficient. And that's simply not the case. They're calcium deficient in the bones, but they're calcium excess outside of the bones. And, of course, this one basic misconcept fuels a lot of the inappropriate calcium therapy because doctors, hey, they're busy, they're working hard, they spend a lot of time in med school and residency, and unfortunately, when they finally get into practice, they really don't have a lot of time to keep up on a lot of stuff, so they will respond just like the public will respond to certain catchy ideas. And the catchy idea of, gosh, if you're really low in calcium in your bones, you must be low in calcium in your body. But in point of fact, that's simply not true. One of the other myths, if you will, and this gets fed by the dairy industry big time, is that you can't possibly get enough calcium into your body without an emphasis on dairy. And once again, nothing could be further from the truth. It's discussed in some detail, but the important vitamin in your body on calcium assimilation is vitamin D. And if you supplement vitamin D to maintain the appropriate blood level, and that's discussed at some length, to maintain the appropriate blood level and have a balanced diet without an emphasis on dairy, you will absorb the calcium that you need. Now, does osteoporosis and these things just go away? No, because there's other things that are going on, not calcium deficiency per se, but other things that are going on that are causing that disease to develop in the first place. And it's a great deal of increased oxidative stress in the bones. And as it turns out, one of the main points of the book is that there's a severe increase in oxidative stress in the bones causing osteoporosis, and this translates into a severe vitamin C deficiency in the bones, and osteoporosis, in every sense of the word, can be considered a focal scurvy of the bones. So the things that you need to take, not only vitamin C, but magnesium, vitamin K, vitamin D, these are the things that allow you to reconstruct new bone and just incorporate the amount of calcium that's needed. But calcium is not, and never has been, and never should be, the primary therapeutic component of osteoporosis treatment or of treatment of anything else.
I can't help but think the beautiful way this plays out every day across this country. There's this unique little test called a DEXA scan, and I know you know all about it. I'm going to ask you to comment on it in a moment. But this DEXA scan has led then to doctors to diagnose things like osteoporosis, osteopenia, and that lays the stage for the supplementation discussion from that point forward. I loved your analogy of the white paint on a fence. You got to bring that in. I'm not going to steal your thunder on it because that describes it all. When in fact, it snuffers the person into thinking things are all is well when it's not all well at all. How about spending some time on that osteoporosis and the DEXA scan way of proving that you need that calcium?
Well, probably the first thing that causes problems with that test is calling it a bone density scan. They ought to call it a calcium concentration scan because these, what they call bone density scans, do look at the content of calcium in the bone, and the higher the calcium content is, the higher your number on the test. And so it seems natural and logical to want, especially if you have a low number on that test, indicating bone that's not dense and that's calcium depleted, you want to increase that number. Well, there comes the problem. If you supplement large amounts of calcium, you will in fact get enough calcium into the bone, not in a healthy integration, but you'll get it into the bone to increase the score on that test a few points. And then the doctor and the patient are happy. They've achieved their goal. They have a higher number on the bone density test, which is really just a calcium density test. But what has not happened is increasing the bone density test with calcium supplementation can give you a better number, but it does not decrease the chance of fracture. So all you've done is make a test look better cosmetically, but you've not even approached addressing the primary problem with the brittle bone that has a poor construction. And the little analogy that you talked about, which I think is
it's a great,
what's going on,
great,
is when you take large amounts of calcium to improve this test, it's like putting a coat of bright white paint on a rotting wooden fence. The fence is going to look better. It might even look newer. It'll fool you into thinking that it's better off, but if you bump up against it, it's going to break, and it's not going to have any greater strength of structural integrity because of the coat of white paint that you put on it. And that's the same thing that happens when you take large amounts of calcium supplementation without any of the other things that are discussed that are needed to reconstruct new bone, which is vital because just taking calcium supplementation will never construct good new bone.
That thing about pain defense, I'll never forget. The image is in my memory. It's locked in there. Great analogy, Doctor. Thank you for providing me that imagery. Moving into this issue of vitamin C, and you coined a phrase that you've then made applicable to so many different medical conditions, but now here with the bone and osteoporosis, you say that osteoporosis is focal scurvy. That is a catchy phrase, and a whole bunch of images come up in my own mind. Could you expand upon that? Scurvy, of course, being a vitamin C deficiency.
Well, of course, scurvy, the concept of scurvy, the definition of scurvy began centuries ago. They didn't even know it was vitamin C. They just knew it was in things that contain vitamin C later to be discovered. But bottom line was, if you stop taking vitamin C in, you eventually develop a body-wide state called scurvy, where basically the body just begins to disintegrate. There's no structural integrity to the tissues. You have an increased chance of cancer, an absolutely astronomical chance of significant infections and bleeding. And for really the rest of time, scurvy has been considered basically an all or none body-wide condition. Well, as it turns out now, it appears that increased oxidative stress, which always occurs when there's not enough vitamin C present, is at the root of all disease processes. So if you have a large amount of oxidative stress in one area of the body, but not another area of the body, you can certainly make a strong case for the fact that you have a focal or a local decrease level of vitamin C with increased oxidative stress in a certain part of the body. And it's a perfectly appropriate nomenclature to call that a focal scurvy, especially when you can then show that when you can go to the appropriate measures to get the vitamin C levels back to normal in that focal area or tissue of the body, you can reverse the disease process in question. Cataracts are very much a focal scurvy of the lens. Of course, the osteoporosis, the focal scurvy of the bones. We're showing more and more that neurological diseases have increased oxidative stress inside the cells and the affected neurons, which can certainly be called a focal scurvy as well. Really, it's the redox balance in the body, the reduction oxidation balance in the body, that determines whether you're sick or healthy. And when that's out of whack focally in a certain area, the vitamin C levels are always low because there's not enough there to neutralize the oxidative stress. Now, I don't want people to think that that just means you can take vitamin C and everything else is going to get better. There are other things you need to do to get those levels of vitamin C up, and just taking vitamin C is not by any means the entire answer.
Not the entire answer, but you spent enough time on it that you devised your own way of presenting it liposomally so that you could actually absorb the vitamin C. And so how you take your vitamin C turns out to be very important, and you've already sort of perfected how that should happen. You want to spend a little moment on that one?
Yes, and the point I was making was not so much how you take your vitamin C as if you want your vitamin C, your liposomal C, your regular C, your intravenous C, if you want that C to have its maximal effect, it's just as important, and in some cases, many patients, even more important, to make sure you get rid of the toxins and infections inside your body that are consuming those antioxidants like vitamin C. So, and of course, this is a extensive subject that people should understand it, and it's also discussed in the book. Not only osteoporosis, but all chronic degenerative diseases are tremendously accelerated, especially cancer and heart disease, by infections in the mouth, such as with root canal treated teeth. Root canal treated teeth are across the board infected, and they're perfect little delivery mechanisms for getting those toxins and infections into the lymph, into the bloodstream, into where you get breast cancer, into where you get heart attacks, and everywhere else in the body. And even when you're taking large amounts of vitamin C, these toxins are so potent they can not be much disturbed by that vitamin C intake. So it's kind of like what Dr. Huggins said many years ago, and I gratefully acknowledge his coining of this, but taking large amounts of C and having a good diet and doing everything right while not addressing root canal treated teeth and other dental infections is like trying to dry off while you're still in the shower. You got to stop the intake. You got to get both ends of the situation. You got to treat something, but you got to stop what's causing the condition in the first place.
And there he comes in again. His influence on you and me, as a matter of fact, is always present, is it not? The dental situation, always driving it home. Between it and cavitations, those two infectious sites, it's like trying to dry off while standing in the shower. It's another image that I'll lock in my brain, my own brain. Thank you very much for it. Supplementation comes in other forms too. You spent a lengthy amount of time talking about, and it's so nice to see that when you're tearing down one institution, you're building up another. There are supplements that you need to take. The vitamin C you've just mentioned, certainly. By the way, how much vitamin C do you think people should be taking every day?
Well, as I just said, with toxins, with different people having different levels of toxins, they have different needs of vitamin C. As a general rule, I would say most people need between 6 and 12 grams of regular vitamin C. When you take other forms like liposome encapsulated vitamin C, this can just be a couple grams. Or when you intermittently get intravenous vitamin C, it doesn't necessarily need to be as much. But for most people, they really need to be taking 6 to 12 grams of regular vitamin C or its equivalent. And its equivalent is something that really everybody sort of has to work out for themselves. But this is also discussed at some length in the book, too, because I've gotten so many questions over the years that I finally took the time to put together a substantial appendix in the book that's called My Guide to the Optimal Administration of Vitamin C.
I should mention to the listeners, grams, ladies and gentlemen, 1 gram is 1,000 milligrams. So just get your mind, I know you don't hear the term gram too much, 1,000. So you're saying if it's regular vitamin C, 6,000 to 12,000, you're going to have a little bit of diarrhea with that, do you think?
Well, again, this is something that someone has to work with. There are a few people are exquisitely sensitive, but most people, if they take divided doses of the regular vitamin C, sodium ascorbate or ascorbic acid, they can take 2 or 3 grams 3 or 4 times a day and get themselves into that dosage range without causing the diarrhea.
Perfect. But you can avoid that whole thing by moving to a liposomal form. You even manufacture or are involved with what's called, isn't it called Lipo-C? Is that what the name of it is?
It's lipospheric vitamin C. It's made by Levy Labs, and I'm a consultant to the company. I don't have any ownership in it, but I only became a consultant to it because I saw their product doing things that at the time I didn't think it was possible for a supplement to do. So I felt it was very much a win-win situation to align myself with a product that I was able to see so much positive effect from.
All right. Let's take another one of the supplements that you spent a lot of time discussing when you were in town, and that's magnesium and the role that it plays in this, because it's a big player according to the way you look at it in terms of helping in osteoporotic bones or getting calcium levels to normalize and strengthening bones. Could you spend some time on the magnesium issue?
Sure. Magnesium is a hugely important supplement, and I really had no idea how important it was going into my research on this book. As it turns out, magnesium is not only a natural calcium channel blocker, so it helps limit the increases of calcium you get inside the cell that you're trying to block. It's also a natural calcium antagonist. I mean, the more magnesium you put into the body, the more calcium is pushed out, and vice versa. So magnesium is extraordinarily critical as a component of trying to normalize elevated intracellular and extracellular levels of calcium in the body. Magnesium will help dissolve some of these calcium deposits that we've talked about that are seen on X-ray and seen inside the blood vessels and inside different organs, often causing cancer. And most profoundly, and I want to say also, I'm talking about not magnesium oxide, these sort of things. You want to take a good anion along with your cation. So along with your magnesium, take glycinate, which is an important amino acid that we need a lot of. So I'm not saying it's the only form, but I'm saying a good form of the magnesium to take is magnesium glycinate. But one of the things that absolutely stunned me, and I'm still having a difficult time completely understanding this, but the incredible importance and impact of magnesium was demonstrated by two studies where they were looking at magnesium in the setting of heart attack and unstable angina in the intensive care unit. And they wanted to see how well magnesium would help these patients in preventing a heart attack or decreasing heart attack size. And so they infused magnesium as much as 22 grams over a 36-hour period. And that was it. That was it. 1 day and a half administration of magnesium, and then they were able to show that this group of patients had a decreased chance of death from all causes for a full 5 years after that magnesium was given. Wow. Now, there's nothing that I can think of in any dose that I can think of that you can give for a day or two that's going to have that profound an effect on general health for such an extended period of time. But that's what the study showed, and I have no doubts that it's because that high administration of magnesium intravenously did a significant remobilization of calcium that had accumulated inside the cells. So anyway, the magnesium is super important, and probably because of the fact that it plays such a critical role in normalizing abnormal calcium metabolism.
Excellent. And that the thing about the 5-year benefit, your way with words creates images in my mind. I'll never forget that one too. You didn't mention that when you were in town. I'm so happy that it came out. About this vitamin, and I think that it's an intriguing one, but our listeners probably maybe don't supplement K2, vitamin K2 at the levels they should, and you feel very important about its supplement, including it in your supplemental regime. Take a few moments and talk about K2, if you would.
Well, vitamin K is very critical in bone health. I'm not saying it's not a good thing to take in general because of the effects that it has on calcium metabolism. similar, not the same as magnesium, but vitamin K will inhibit metastatic or abnormal calcification outside of the bones. As a monotherapy, using just substantial doses of K, and we're talking K2 here, MK7, MK4, or the subtypes. When you take enough vitamin K, you not only prevent fractures, but you keep the bone density from deteriorating, and you overall improve bone quality. They've also shown that vitamin K can lessen the chances of coronary heart disease, which undoubtedly relates directly to the fact that it can mobilize abnormal calcium deposition, and it's certainly abnormal calcium deposits that are a strong role in promoting atherosclerosis. But a point, and it was not only true with the magnesium, but it was also true with the calcium. Calcium, as a monotherapy, as a monosupplementation, will also decrease all-cause mortality. Now, when you can take anything, like a magnesium, like a vitamin K, that's going to decrease your chances of death from all diseases, not just heart, not just cancer, then it's overwhelmingly logical that if you're decreasing the chance of death from all diseases, then you're improving the health of all the cells. So you're doing something at a primary spot in physiology inside the cell to normalize intracellular metabolism. And what I submit in the course of the book and in the presentations that I make is that it's the normalization of calcium metabolism, the getting rid of the excess calcium, the increased calcium that is seen inside cells, and is uniformly seen as a common denominator in all chronic degenerative disease. I'm telling you, Dr. Courtney, no matter what the disease is, the affected cells have increased intracellular oxidative stress, which is always accompanied by or caused by increased intracellular calcium. So the magnesium, the vitamin K, and as we can talk about later, vitamin C and vitamin D, all of these things have primary effects on calcium metabolism, and because of that, they decrease your chances of death from all causes, which is not something that most supplements can assert, not something that hardly any pharmacological agents can assert.
Yeah, evidently. And you just mentioned vitamin D. You might as well swing into a discussion of that because it's so intimately related to calcium absorption that you just got to talk about it.
Well, there's been a lot of stuff on the horizon on vitamin D in the last decade or so. For a long time now, vitamin D has had a recognized role in calcium absorption, calcium assimilation into bones, and all of that was quite valid, but as it turns out, there are vitamin D receptors in every cell of the body. Now, nature does not design a receptor to be present where it doesn't have a function. So the point being is vitamin D has a role in every cell in the body. And as such, it's now been recognized as an important factor in, I think, nearly 2,000 genes, and it's been recognized as a primary factor in preventing infection and preventing malignancy. Now, as we've just discussed, it's also very critical in calcium and bone metabolism. And when you take the right amounts of vitamin D as a monotherapy, you do decrease your chance of osteoporotic fracture. You decrease your chance of death from all causes when you have vitamin D in the normal range. Now, the problem, and it's not a big problem, but the problem with vitamin D is you have to take the right amount, okay? The vitamin C, the vitamin K, the magnesium, those are pretty non-toxic, so take as much as you want. Vitamin D, you have an increased chance of death if your vitamin D level is too low, and you have an increased chance of death if your vitamin D level is too high. So you got to take it, and you got to take it right. There's a lot of evidence to show that you want to get the blood range, and this is a blood test number of your vitamin D in the 50, 60, 70 nanogram per cc range. What this turns out to be for most people, most adults, is about 5,000 units a day. But that's an approximation, and when you're first starting to supplement vitamin D, you need to get some baseline blood testing, and hopefully you have a doc you could work with, and you can get a follow-up blood test 6 months or so down the road and see if you're getting it in the right range. Most people over extended periods of time will end up maintaining well on 4,000 or 5,000 units a day, but somebody that has a severe deficiency might need a whole lot more early on. So it's good to get some guidance with this one, but people should not ignore taking it, because both the low end is bad for you and the high end is bad for you too.
Hey, speaking of a guy, myself, that pushes that window, how high would be high in your opinion in terms of the vitamin D levels that could get you into trouble?
Well, you don't want to be consistently. First, let me say what I'm going to say is my best grasp of the literature. I struggled with this because there's a lot of conflicting data out there. A lot of things say this, a lot of things say this. But after going over, at least dozens of different vitamin D papers, if not 100 or more, the final feel, if you will, is that you don't want it to be consistently over 100.
Oh, okay.
Okay? Some people can do well on 80 and 90 and going up to 100. Some might do well a little bit more than 100, but you start getting into the range where the vitamin D brings too much calcium into the body and then effectively acts, if you will, as an unneeded calcium supplementation, because you start bringing too much calcium into the body. So for most people, getting it into the range of no lower than 40, and as a practical point, no higher than 80. So I say get it into the 40 to 80 range, 50 to 60 being ideal.
That's a very important parameter. Thanks for answering that question, because pushing that 100, I don't think going over 100 is healthy either. So we're both in agreement, as it turns out. Those are supplements. Now you also mentioned hormonal influences when it comes to calcium and the correct supplementation of it. Could you spend some time talking about thyroid and the estrogen-testosterone connections?
Well, as it turns out, not surprisingly, to me, some of the most impressive information you can gather in the literature is seeing in a well-conducted study if an agent or the lack of an agent increases your chance of death from all cause, the all-cause mortality. And as we saw, it's affected by all the agents we've talked about so far. And as it turns out, when you have low testosterone as a man, low estrogen as a woman, or low thyroid function as a man or a woman, you have an increased chance of death from all causes. Not only that, when you have low levels of these hormones, you magnify the effect, the abnormal effects of any other deficiencies or problems that you have. So the point being is very important no matter what your condition is, especially if you're getting a little on up in years. You need to check these hormone levels. Now, the important point therapeutically is, especially with older individuals, with estrogen and the thyroid, you should never treat a low normal level. You need to treat abnormally low levels. So something needs to be below the range of normal before you start treating it. Because hormones, as I say, some older individuals, you put too much hormones in them, it's like putting rocket fuel in a Model T. I mean, there is a price to pay if you over-rev the body. By the same token, that does not mean you should not take an approach of gently supporting a diminished hormone capacity. So, when you have abnormally below normal levels of estrogen or testosterone, you do a low level of restitution or supplementation of it, treatment of it, to get the patient no higher than the mid-normal range and quite satisfactory in the low normal range. So just push them up into the normal range, but don't get greedy, don't overdo it. And when you add this, let's say, minimal hormone restitution to the rest of the different nutrient supplementation we talked about, you can bring a lot of people into a really good state of solid health for an extended period of time. The thyroid hormone is a little tougher because thyroid hormone tests are just lousy unless you have very high or very low thyroid function. So most people will want to have a mild hypothyroidism, and oftentimes clinicians are going to have to be using thyroid supplementation, whole thyroid extracts in ways, and really ultimately need to use their clinical evaluation rather than serial thyroid supplementation to see that they're getting thyroid normalization.
Yeah, those blood tests just aren't what they're cracked up to be, and we're wise to point out it should be all clinical, and forget those blood tests. just hate them. We are right up there. We have bongos in the background signaling our time out of here. We have taken it right up to the gong. Dr. Levy, thanks for allowing me to invade your morning and sort of clean up a bit from all the devastation and havoc that you caused when you were in Pittsburgh. I look forward to your return, and sometime in the near future to Pittsburgh, I'll be talking to you, my dear colleague. Thank you so much for coming aboard today with us.
Okay, thank you, Dr. Courtney. Always happy to talk on your show.
Okay, bye now. There you have it, ladies and gentlemen, a brilliant one himself, Dr. Thomas Levy. Death by Calcium. Get the book and throw your calcium supplements away today. See you on Monday, not Friday. Going to be at the conference. Until then, this is Dr. Dennis Courtney with Dr. Thomas Levy saying so long for AIM Impact on Your Health. You there, Thomas?
Located at 3075 Washington Road.
Dr. Courtney.
Yes.
What's going to play Friday? Do you know?
Let me just, let's do it quick because I want to go to that conference on Friday. And we might as well do that first one with Frank, which was back in January 10th.
Okay.
Okay?
We'll do it.
All right.
Alrighty.
Bye.